How do pathologists interpret bone cancer biopsy samples? When doctors suspect bone cancer, they often need a close look at a small tissue sample from the bone. This sample, called a biopsy, is carefully examined by a pathologist to find out if cancer is present and what type it might be. The process begins with the sample being collected through methods like core needle biopsy, curettage, or incisional biopsy. Once the tissue is obtained, it is processed and prepared for microscopic review. The pathologist first describes the sample's gross features, noting its size, shape, color, and texture. These details help orient the microscopic evaluation and can sometimes reveal visible signs of tumor. Next, the tissue is examined under a microscope. The pathologist looks at the shape, size, and arrangement of the cells. They check for abnormal features such as irregular nuclei, increased cell division, and cellular atypia, which are signs of malignancy. The pattern of how the cells grow and interact with the surrounding bone tissue helps determine whether the lesion is benign or malignant. If it is cancer, the pathologist works to identify the specific type, such as osteosarcoma, chondrosarcoma, or Ewing sarcoma, by analyzing how the tumor cells look and behave. To refine the diagnosis, special tests are often used. Immunohistochemistry involves applying specific stains that detect proteins or markers in the cells. These markers can help distinguish between different types of bone cancers or identify the tumor's cell of origin. For example, certain markers are more common in osteosarcoma, while others are typical of chondrosarcoma. These tests are especially helpful when the tumor's appearance alone does not provide a clear answer. All these findings are combined to produce a final diagnosis. The pathologist reports the exact type of bone cancer and may also include a grade, which indicates how aggressive the tumor looks based on cell features. This information is vital because it guides the medical team in choosing the best treatment options, whether that involves surgery, chemotherapy, or radiation therapy. If the biopsy results are inconclusive or uncertain, the pathologist might recommend additional testing or even a repeat biopsy to ensure accuracy before any treatment begins. The interpretation of the biopsy is not done in isolation. It is always considered alongside clinical information and imaging studies like X-rays or MRI scans. The medical team works closely with the pathologist to correlate microscopic findings with what is seen on scans and how the patient is feeling. The biopsy track, the path made during the procedure, is carefully planned to avoid complications and to allow for potential removal if needed. In summary, pathologists interpret bone cancer biopsy samples by meticulously examining tissue under the microscope, using special tests to clarify the tumor's nature, and integrating all this information with clinical data. This thorough process ensures that the diagnosis is accurate and reliable, forming the foundation for effective treatment planning. Always remember that each case is unique, and personalized medical advice from healthcare professionals is essential for the best outcomes.